Hi, my name is Mehri Maksud. I am a coordinator of med programming. I am very pleased to introduce Dr. Michele Long, Associate Professor of Pediatrics at the UC San Francisco School of Medicine, and Dr. Kathryn Sutter, Assistant Professor of Pediatrics at the UC Davis School of Medicine. They will be together presenting the workshop, What is Pediatric Medicine? Please welcome them as they show you the magic behind pediatrics. Thank you.
All right. I'm going to let my colleague Michele start talking.
Hi, everybody. So we're going to start off first briefly with introductions. I am Michele Long. I am, as was noted in my introduction, an associate professor of pediatrics at UCSF. I work as a hospitalist, which is a doctor who only works in the inpatient setting. And I've done so at hospitals throughout California, including in San Diego and at Stanford and at UC Davis.
I'm Kathryn Sutter. I'm assistant professor at UC Davis Medical Center here in Sacramento. I am also a pediatric hospitalist, so I only take care of patients in the hospital, which will tell you a little bit more about the differences between doing that and being an outpatient. UC Davis was my first place I started at in my career after residency, but I trained at the University of Minnesota. And yeah.
And I forgot to mention, I trained at Vanderbilt University in Nashville, Tennessee. Let's see, show of hands, please. I know that we're being mic'd, but we want this to be as interactive and comfortable for you guys as possible. So who here is from Northern California? Looks like about just over half of us. Anybody here from other parts of California? A couple, and who's traveled from out of state? Is that it? Okay, where are you from? New Mexico, excellent, welcome. Glad to have you here. Okay, so good, okay. So we're gonna start off, I think, a little bit with, we're gonna try to divide the next 45 minutes up into little sections of things that we think would be relevant to you if you're interested in pediatrics. And then at the end, we should have time for some questions. If you'd like questions throughout, please go ahead and ask them. We're gonna, we'll be happy to answer them throughout, so please feel comfortable. And as we get near the end, we'll get a 15-minute warning. And once we have that, we'll probably finish up the things we were going to say and then open up for more questions after that, okay? So the first thing we want to do is get everyone on the same page and talk basically about what is pediatrics. Pediatrics is a field of medicine where you take care of kids, starting from the minute a child is born and all the way up to ages 18 and sometimes up to ages 22 or 23. People who work in the field of pediatrics may specialize and only take care of babies or only take care of teens. But the training process to become a pediatrician involves completing a 3-year pediatric residency. And in the 3-year pediatric residency, you'll care for children of all different ages. So you'd be prepared to pursue a career caring for any of those ages when you're done. Anything else at that time? No. Anything to add, Kate, about that? Okay. So I think the next thing that we wanted to talk about a little bit is the basic training involved in being a pediatrician. Usually, your training for becoming a pediatrician begins after medical school. If you had to suggest the last moment at which you could possibly figure out that you think you want to pursue pediatrics, it would be actually within medical school. So you can go to medical school and not know that you want to be a pediatrician and then become a pediatrician. What happens is the first 2 years of medical school are called the preclinical years, or the years in which you take the foundational science you learned in college and other areas and you adapt that to medicine. And then usually during the 3rd year of medical school is when the clinical rotations start, and you'll get exposed during the 3rd year of medical school to fields such as adult medicine, pediatrics, obstetrics, family practice, and surgery. And it's a good time to help and solidify your decision. So some people wait until that point when they realize that they were meant to become pediatricians, and some people know it before that, sometimes when they're young, sometimes at college. And you can prepare for a field in pediatrics independent of when you figure this out. So.
I think that's the exciting thing about medicine in general is that taking this process, you may have one road and you may decide to divert from that road. And it's okay that most times, even if you're in the middle of your 3rd year of medical school, you still might be trying to make that decision, and that's okay. You'll figure out how to do it. So I wanted to talk a little bit about the different aspects as once you've gone through all your training, what is a day in the life of a pediatrician? What do we do? Why would you want to do it? What are some benefits of doing outpatient medicine, meaning in the clinic? So everybody here probably had some sort of physician, either a family practice doctor or a pediatrician, that they went into, and when you're 5, you always ask mom, do I have to get shots this time? Are they going to give me any shots? That's what an outpatient pediatrician does. So they're a general pediatrician, so they're going to go through their 4 years of medical school. They're going to have 3 years of residency training in pediatrics after that, and then they can go on to be an outpatient physician. Outpatient physicians have a lot more predictability in their schedules. Most of their jobs will be from 8 to 5, something of that sort, either 4 to 5 days per week. So again, you have kind of a predictable schedule. This is when I go into the clinic, here's how many patients I'm going to be seeing, things like that. Now, any type of physician you want to be, for the most part, you probably know there's going to be some extra duties, right? A physician can't just be on from 8 to 5 and then there's nothing for the family to do after that. So there's always going to be, even as an outpatient physician, you may have to take some night calls, meaning moms are going to call in, they're concerned about their child. You may have to answer those questions. You may have to tell them to go into the emergency room. There may be some weekends where they're going to work from 11 to 3 seeing patients. So you're going to have some of those responsibility as an outpatient doc, less so than other types of pediatrics. Within pediatrics, a good thing to know, it's very similar, what I say, to adult medicine, internal medicine, where you take care of adults. They have abilities to subspecialize if there's certain organ systems you like. You like to learn about the heart. You want to be a cardiologist. You can do that in pediatrics. We have just as many subspecialties as they do in adult medicine. Yeah, except geriatrics. We don't have geriatrics. But they probably don't have neonatology either, so where we take care of all the kids in the ICU. So that's kind of a general outpatient physician. They have some predictability. They have continuity with their patients. You can see a child at one day of life and follow them all the way through till their 18th birthday and they're heading off to college. That's some interaction there that you can't get in a lot of other jobs that you have. They also have I forgot what I was going to say, but there's one more good thing that I forgot to say.
I think the big ones that you mentioned to me were continuity, predictability.
Preventative medicine. Mm-hmm. So a lot of outpatient medicine is also considered preventative medicine. So you're actually going to see a lot of healthy kids. Healthy kids come in the clinic, and your job is to make sure that they stay on that healthy path. You can prevent them from going on to obesity, going on to diabetes, going on to heart disease. So you're going to do a lot of that education with the families and get to know those families very well. That's an important and key part of being an outpatient general doc. What I do and what Michele does as hospitalists, what we consider ourselves is we're inpatient docs. So we take care of children in the hospital. And basically then a child has to be sick enough to have to come into the hospital. So I no longer see healthy kids. I don't see them for their well child visits. I don't have necessarily the kind of continuity that an outpatient physician has. I have flexibility in my schedule, a little more than the predictability. I don't have as much predictability. I know that when I'm working longer hours. I may be working 12 to 14 hours a day. I will probably have more night calls. I may have times where I have to spend the night in the hospital. But with those longer hours that I'm working, I have some weeks that I may be off. I don't have any patient care duties. I don't have any patients that I need to worry about, make follow-up phone calls on, and things like that. So that's what I like a part of my job, is that flexibility. I like working really hard and being really engaged, and then having a little bit more time off than the outpatient may have on a regular basis. For those who are interested in certain areas, certain organ systems, taking care of just the little preemie children versus adolescents, you can do that in pediatrics. It's going to cause extra training. You'll find out that if that's what you really want to do, the training isn't so bad and the time goes pretty quickly. But again, you do 4 years of medical school, 3 years of a regular pediatric residency that will get you to become a general pediatrician. And beyond that, you'll do what they call a fellowship. So that's going to be 3 additional years. If you like the kidneys and want to deal with children who have kidney problems, you can become a nephrologist. If you like the little preemie babies, you can do 3 years in the NICU, the neonatal intensive care unit, and take care of those preemie kids. If you like adolescents. So there's lots of opportunities there that you can do. And then you'll decide, do I like taking care of the whole child, or do I like that kidney more than anything else? Research and academic medicine, those are all other things that you'll think about, but those are all other aspects of pediatrics too.
Does anyone have any questions about the general idea of what pediatrics is and what the different offerings are in terms of the outpatient, inpatient, or specialty fields that you can do with pediatrics and the training length that one takes to get through to pediatrics?
I have a question for the two of you. Are you guys general hospitalists or do you have specialties?
So the question was, are we general hospitalists or do we have specialties? We, right now, oftentimes when one chooses to be a hospitalist or work in a hospital setting, there are a variety of things that one could do. One could be a hospital-based provider of neonatal care or babies and deliveries. One could be a hospital-based care provider of all kids that are admitted. One can learn the skill sets of sedation and sedating children who need that to happen. One can work in a children's hospital, or one could work in a community setting, and when they work in that hospital, be basically the main referral pediatrician for that. Currently, I work at a children's hospital, and I have a single place that I work right now. Kate?
My job is, I'm considered a general pediatrician, so I didn't go on to do any fellowship training, but what I do is I work in what we call a tertiary care center. So that's more of a children's hospital where I have subspecialists there. We have intensive care units. Children can get flown in from northern Oregon to the Nevada border to see, so much more complex patients. But I also work at a community hospital where I am considered the pediatrician consultant. So I will consult with the emergency room docs if they have a child in there that they have questions on. So there, I am kind of the specialist in pediatrics, but I didn't do that training to become a cardiologist or to become an endocrinologist and work with children with diabetes specifically. Did that answer your question? Okay. Any other questions about what we've talked about thus far? Everybody wants to be a pediatrician? You got to learn how to do this. Yay! It's fun. We like it. No.
So the next thing we were going to talk about a little bit was what you can do if you're not in medical school and you have an interest in pediatrics and you want to prepare yourself for a possible career or to potentially get more exposure. We started earlier by saying that that's not a prerequisite for going into pediatrics, but if you're interested right now, we do have a couple of ideas of things that might enhance an application for someone who wants to go into pediatrics and make them know that they like the field more. The first is basic, it's pretty obvious, which is find some way to interact with children in some sort of formal setting where you have a defined role. That might be volunteering at like a camp for kids who have special needs, perhaps a medical camp. It might involve just volunteering in a setting where you're interacting with kids, perhaps interacting in a hospital. A lot of times hospitals will have a children's playroom and you can volunteer there. You won't get a lot of medical experience, but you'll get to be around kids when they're having some form of illness and when they're well, and you can see if you like being around them a lot. That makes you know that, kids are wonderful, but for some people they can be really annoying because they operate on a different developmental level, and it can sometimes be hard to concentrate working around them. People who are pediatricians don't really have a big problem with this. They figure a way to work with it, or it makes their lives better, and it'd be good for you to figure out if that was you or if that was not. So one idea is to just start working, find an opportunity to work with children in some sort of way so you can enhance that. In an ideal way, you would be able to find a way to work with them in some sort of a medical capacity. And I think that's very difficult until you're actually in medical school. But one thing you can do is, if you have volunteer opportunities, try to find a way in which you can develop some continuity or stay someplace longer term. Longer term experiences suggest a degree of commitment, and they suggest that you have a passion for something because you're willing to give to it. And that looks good when you're applying to a school that wants to know if you're really committed to medicine and really committed to doing things. It's a lot easier to go volunteer for 2 hours one night, but to stay involved and perhaps go on a regular basis and make long-term relationships, that will help you learn more about your passion for fields and a passion for medicine. And taking it to an even extra level, if you have the ability to not disrupt other studies and the rest of your life, if you can obtain a role of leadership within a passion for which you interact with children or that benefits children, that will look really good, okay? Because to be a leader means to help guide others, and leadership skills are really important in medicine nowadays. And people who can contribute back and find ways to balance both the responsibilities in their life with giving back to something else is really good. If it's not in pediatrics, that's okay. It should be something that matches your passion. But if you think you like pediatrics, it would be great if you could find a way to do that. So the ways that you could make this happen are to get involved with an activity you're passionate about and inquire of the people who lead it, how can I make this something more long-term or something I could be a leader in? And another way would be to find somebody who you know of to be a mentor who wants you to do well. And if you don't know that person, perhaps a school advisor could help connect you with somebody who will be passionate to help you do well. And you can tell them, I want to give 2 to 3 hours a week of my life, or I want to give this amount of time, or I want to make this experience better, and see if that's possible. So none of these are requirements, but they're just different levels of commitment that you could use towards pediatrics to know more about pediatrics and to be more prepared to be a medical student and a future physician.
Yeah. I think she hit on the key points. And to know there too is if you're not sure you want to go into pediatrics and you have something else that you're passionate about, do that. Because that again is going to show your ability to stick with something, show passion about something, maybe become a leader in something, and that can go into all realms of medicine. So it's okay to not know that you want to be a pediatrician yet. It's okay to know that, wow, I want to be a pediatrician, and you're in med school and you divert and you go someplace else. I think that's the exciting thing about medicine is you get exposure to multiple things. But we are here to advocate about pediatrics.
We are.
So
before we do, does anybody have questions about experiences that you're doing or that you're considering doing related to preparing for a possible career in pediatrics?
Okay. So we were going to talk about, well, what are kind of the benefits of being a pediatrician? What are some of the challenges of being a pediatrician? And maybe kind of talking about our story very, very briefly of how we got there. So I was maybe considered a late bloomer. I didn't know at a young age that I wanted to go in medicine. It probably was not until my 2nd or 3rd year of college where I really got excited about it. And it was through those opportunities I had taken. I had volunteered. I was able to shadow with a pediatrician in the area who I found from basically a family friend. That I said, hey, this is what I want to do. I didn't know I wanted to go in pediatrics. I knew I liked kids. A lot of my volunteering had to deal with kids because that was something that I liked. I can communicate sometimes much better with a 6-year-old than I can with an adult. My husband says that sometimes too. But it was something I was excited about again, so I showed that passion there. I didn't know for sure I wanted to do pediatrics, but that was something I was excited about. That was something I could show some longitude in and hopefully get those med schools knowing that I had that passion, that I had that drive. In medical school, I knew I wanted to do kind of the big aspects of medicine in general is you can be kind of a primary care physician, meaning you take care of a whole patient. So in pediatrics, we take care of the whole child. In adult medicine, they take care of the whole adult versus doing some sort of surgical specialties, right? A surgeon they're going to take out that appendix, they're going to do the best job at that, and they're going to send them back to the family practice doctor or me as the pediatrician to take care of the rest of the body there. So you get exposed to all of that in medicine, which is great. It showed me things that I was excited about. And the story I tell, I knew I wanted to do primary care. I had trouble deciding between family practice and pediatrics. Something that helped me with that is in family practice, I decided if I was going to do it, I wanted to do the whole thing. I wanted to deliver the baby, I wanted to take the baby through the whole thing, and I wanted to take care of the parents. Well, I did my OB rotation in my 3rd year of med school, thinking I was going to love it. I did not like it. It scared the heck out of me. My heart was racing, and I found out it was racing to get me out of the door, not to sit there and say, what a wonderful experience. It's a fantastic experience. I'm glad I got to deliver babies, but I realized at that time that that might not be a part of my job that I wanted. That helped me kind of decide between family practice and pediatrics. I did my pediatric rotation, and the part that I loved is it was a busy night. We were on call, meaning I was there as a medical student for 16 hours. It was 8 p.m., I'm writing my note, and along rolls by down the hallway is a mom with the IV pole pulling the wagon of the 2-year-old with her. And I said, this is the kind of place that I want to work. These are the kind of patients that I want to take care of. But it was a tough decision at first. It's not something that came to me right away. But it did kind of finally present itself, and that's how I became a pediatrician.
So I guess how I kind of got to pediatrics, and one of the reasons I chose it, I kind of like Kate, I'd always enjoyed interacting with kids as I got older, and so that was something that was interesting to me. And I didn't necessarily know that I was going to go into pediatrics, but I had an inkling during my 1st year of medical school. And when you start medical school, there are a lot of experiences you can have to cement that. There are opportunities to go into classrooms and volunteer and teach kids of different ages and see if you like interacting with kids on that level, talking about medical things. And so that was definitely something for me. During the 3rd year of medical school, the clinical year, when you get to experience all the different fields, a lot of my friends that I worked with would have problems, and family members would often ask me because the kids were so sick, and that must be a very hard rotation. And for me, that wasn't quite as concerning for me as recognizing that, yeah, they're sick, but someone's got to take care of them, and I enjoy doing that, and perhaps I can add something to their life. And I found that I wasn't going home with a heavy feeling always of sorrow because they're sick. That was there. But I went home happy at the things I'd done to make their life a bit better, even if I couldn't solve their problem. So people have different experiences. Some people, I remember being on my rotation and working in a setting where I was in the adult, in the emergency department. And my pediatric patient was being admitted, and I was writing a note. And my friend was on the adult rotation, and they were writing a note on their adult patient, who was very ill and not feeling well and about to get medication and groaning and making noises. And I jokingly asked them, can you do something to help your patient out? Because I can't write my note because they're making so much noise. And he looked at me and said, can you do something to help your patient out? Because I can't write my note. And sure enough, my 10-month-old was over there crying because they were getting an IV started. And it's kind of like I just tuned that out. And it was something I noticed that I was able to provide for the whole pediatric patient and not be worried too much about the noises or distractions that come from that, and able to focus on the job at hand. I had an important job to do, and I was able to do it to make them better. So that was one moment that I thought pediatrics is something that I'm gonna do. One thing about a pediatric ward is that it's fun. When you are or caring for pediatrics, you have to make sure that you demonstrate compassion and care for families, but a lot of kids need you to be happy, even if they're really sick. So you can't walk in a room and cry at a child who's lost all of their hair because they're getting treatment for their cancer problem. You have to go there and be the advocate for them and try to make them happy and get them through it and support the family through their tough time. So interacting socially is a really important part of pediatrics, and I found that I liked interacting with kids, but as much of that is interacting with adults. They have parents that love them, that care so much about them, and they're kind of looking at everything you do and making sure you're not messing up on their kid. And I find that to be a blessing because it's one extra person helping me do a very, very tough job. So in pediatrics, we're a very collaborative group. We tend to work together and we value the ideas of others. I'm ecstatic when someone who maybe isn't at my level of training finds a problem or a concern that may help our patients. So we work across levels, and that's a really important part of being a pediatrician, is being open to that and being able to say, I don't know, or I don't have the answer, but I'm gonna go find someone who does, because you've got to make things better for a child. those are kind of the things that I liked, which was basically the fact that it tends to be kind of a fun environment. It's very collaborative when you work in the field of pediatrics. You care for kids and their parents' needs, what they have related to their kids. That's good. And I think it's important that your compassion is always very high. As you go through medical school and as you go through residency and as you become a doctor, you get tested. You have your own needs, which include your own family needs and your own needs to eat and take care of yourself, and you're constantly balancing those needs with the needs of someone who's experiencing possibly tragedy and could need everything from you, and you have to balance those two. And I found that when I've had to give to my patients, it's something so important and so valuable that creating the balance that works for me, I'm not too resentful when I leave the things that I have in my life and go take care of my patients, because it's usually very, very important that I do so. So those are kind of the reasons that I went into pediatrics.
And I think those are the things that you'll start thinking about as you move forward on this career choice, if that's your choice. Is, for me, it is the fun. I like the fun in my job. I tell my husband I get to go play with kids all day long. Now, there's a lot more to it, but I get to go play with kids all day long. I get to have my little light that looks like a cow, that nose lights up, and when I hit the button, it says moo, and a child smiles. I like that as part of my job. It's goofy. It gets me excited. I can talk baby talk to the baby and yet also have a very real conversation with the parents at the same time. Some people may see that as a challenge. I see that as a benefit of my job. Talking with the parents, some people see that as a challenge. And granted, there are times when I know that it is a challenge to work with that parent and come on the same page and try and figure out what's best for their child. But I enjoy those times. I enjoy having them advocate for their child, and I also advocating for their child. Another thing to think about in pediatrics versus adult medicine of some sort, or any type of medicine, is what kind of diseases do you see? Are they all the same thing? Am I seeing the same thing in a 2-year-old that they are seeing in a 50-year-old male? No. I don't worry as much about heart attacks or strokes or things like that. I have different disease processes that to me stimulate my wanting to learn, me wanting to find out what's going on with this child. So there's other aspects like that that can get you more excited about pediatrics or some other type of medicine.
And there are certainly challenges. I've known, I've worked with friends and students in the past who've had moments where they go and part of their pediatric experience for the first time involves working in the pediatric intensive care units and seeing children that are maybe hooked up to a lot of machines and have a lot of IVs, and that can be really hard to see. And some people look at that and think it's their job to focus on managing and improving, and they're able to get around it in the short term. And some people look at it and say, no, I cannot do this. It is too disruptive to my core and my psyche, and it is not something that is about me. Which is why we were talking earlier that it's okay to change your path. When you have experiences, you want to have a good set of people that you can talk to about them, and then decide whether that's going to keep you going on the path or whether you're going to pick something different. So
we have about 10 or 15 minutes left, so it's a good time if you guys have questions. We'd love it to just open it up to any questions that you have.
I would say we just did a version of this talk in a room downstairs, and there were a lot more questions. I think it's because we weren't being taped, and I didn't have a bright light on me, and it didn't feel like this. But please feel comfortable to ask questions. If there's something that we talked about that seems interesting or that you didn't understand, please feel that you can talk to us, which means that you guys better come up with some questions, because I'm going to look real bad if no one says anything right now.
Because these long moments of silence are just really tough to get through.
The hands
right?
go up. I love it. Okay, you were. Oh, you were up before I even said my soliloquy, so go ahead.
In terms of your hospital rotations and like your work with the pediatric wards in the hospitals, the stuff you saw, did that help you determine that you didn't want to necessarily do hospital work, or like or versus clinical, or?
I think seeing patients and being involved in their care is one of the most important ways of figuring out what you want to do, and it makes it really tough for you at this stage, because at the last session I spoke with somebody who wanted to find some authentic patient care experiences, and they're very hard to find at this stage of your life, because you don't have the credentials to be able to examine patients and to become integrated into the care process, and shadowing is not necessarily the best way to do it. But I will tell you that third-year experience, for me, that third-year medical experience was like tantamount in making sure, in solidifying what I wanted to do. That's really when a lot of decision making happens. For each of those fields that you do, you only do 4, 6, 8, 10 weeks in them, but you do so much and you see so many aspects of it that come really quickly at you, it really helps you make decisions.
And the nice thing, even though, you know, heading on to the career of medicine, it's a long road and it's many years, but each step gives you kind of more dividing points. So as far as that question you have, you don't necessarily need to answer that question in medical school. You only need to answer, do I want to be a pediatrician? But then when you get into pediatric residency, then you get to decide a little bit more, do I want to be more focused on the outpatient versus the inpatient? So it's nice, you do have a few of those steps of saying, I don't know right now, I can't make this decision, I knew I want to do pediatrics, but you have a little time to do that. So, other questions? Yeah?
What did you guys do during your residency?
What is it?
What jobs did you guys do when you guys were doing your residency?
So my residency, I did my residency in San Diego, at UC San Diego, and the way residency usually is divided up, this can vary, is they're divided up into blocks that are usually around a month in length, and you basically experience all of the different important decision-making subfields of pediatrics, if you choose to do a pediatric residency, that you take care of patients that need to be cared for, so that's one of the things you're doing. Part of it is service, but part of it is what you need to experience to know what you're going to do next. So we do a month working on the inpatient setting where we only take care of the kids that are hospitalized. Then we'll do a month in the clinic where we do clinic the entire time. We might do a month in the neonatal intensive care unit where you take care of the sickest babies for a month at a time. Then you might do the intensive care unit for the kids older than babies that need care in a concentrated setting with close monitoring. You might do a month of advocacy where you get to learn about projects that are going on to try to change laws to benefit children. You might do a specialty month where you get to pick a field. Like, so you might think, I've always thought that gastroenterology, or the study of the stomach and the intestines, is interesting. So I'm going to do a month of that and just see if that's right for me right now, potentially in the future. So you get to cycle through all of those different things. And additionally, after your third year of medical school, before you go on to residency, there's some flexibility in the fourth year for you to pick some things that are pediatric and some things that aren't. So if you still need to make some deciding, if that third year wasn't enough, you can do a couple of concentrated things in pediatrics or in surgery or in OB-GYN or in family and make that decision.
I had a question. You guys work in the ICU on the floor and both, and like what's the difference between that?
So we both work on the pediatric floor. So again, children are sick enough to be in the hospital, but not sick enough to need the intensive care unit. In general, most of the intensive care units are going to be, the doctors there are going to be PICU doctors, pediatric intensive care unit, so they're going to do that fellowship in that to be more focused on that. So, you had a question? No long, okay.
Like, have you guys ever dealt with a heartbreaking experience before?
Yeah. I definitely have those patients in my mind that will always be a part of my life. That have been very difficult. We talked about this before too, that everybody finds a way to kind of deal with those stressful situations and to deal with that burnout. Some of it for me in those cases, and I kind of realized that I was doing this as I was going on, not understanding what was happening, but realizing it through medical school and residency, is there's a few times when I had those heartbreaking cases, those cases where I couldn't do enough. The outcome wasn't what I wanted it to be. It was very tragic, and I found myself that I wasn't crying. I didn't feel like I was as upset as I should have been, and I felt like I was losing my empathy, and I was losing my compassion, and I wasn't there for them. And what I realized over time is what I was doing is I was protecting myself. is saying every time I saw a tragic situation, if I got so emotionally invested that that's all I could think about, I couldn't be the doctor that I needed to be for my patients. And I learned how to work with that and be okay with that, meaning I knew what this situation entailed. It wasn't any less tragic. It wasn't any less sad. I was still empathetic and compassionate, but I was able to, again, keep a part of myself in that situation. And there's other times where I've had tragic situations where I've gone into the family, we've hugged, we've cried, we've gone through all of that together. So that's one of the ways I found out through medicine, how to protect myself and to be able to keep myself from not burning out. Other things that you think about is in any stressful situation, how do you deal with any life stressors? What do you do to stay healthy and to take care of yourself? We talk all the time. Michele and I'll call her up. She's in San Francisco. I'm in Sacramento. I'm like, do you have 5 minutes? We need to talk about this. I don't know what's going on with this patient. I need to work through this. So I have then support aspect of things within medicine, my colleagues, and then also at home.
Yeah.
Is anybody? Yeah.
For me, I've been finding it difficult to get a volunteer position at a hospital. Do you have any advice on how you may, I guess, be a step ahead of everyone else trying to get that volunteer position specifically for kids?
So the only suggestion that I would have is going back to the idea of the best way to find an experience that would be good for you in terms of getting more exposure to and showing your passion for medicine would be to pursue something that you're passionate about, or pursue something you're kind of passionate about, but that someone's advocating for you with, so that they're invested in seeing you succeed. So if you're trying to get a spot to volunteer at a specific hospital, you know, get a big list of hospitals. There are a lot of hospitals that aren't the main hospital where you are, and small hospitals may be able to accommodate you. Perhaps these ideas have already come to you, but I recall that I volunteered when I was in my undergraduate I went to UC San Diego, so I went to the UCSD hospital, right? A begets B, and everyone was doing it. It made sense. But if not, I could have probably found about 20 hospitals and called them up directly and said, I'm a student passionate about becoming a doctor someday, and I would love to help you out in your hospital and learn a little bit how things work. Is there any way you can accommodate me? Is there something you can use me for? That's one way. And another way is to go to a student who might be a bit older than you, or any medical student contact that you can make in the place you are hanging out, wherever you are going to school, anybody who's nearby, through a friend, contact them and just be open to any kind of experience and see what they have to give you. And then the final idea would be your advisor. It's go to your advisor and say, this volunteer experience isn't working. Sometimes there are research labs or research studies that are going on that you can learn about on websites at institutions where you are, and somebody might want a student volunteer to help out with that project, and you could do that. If you couldn't do that, perhaps you want to do a specific field in pediatrics, or maybe something looks interesting. A lot of physicians have profiles online, and they'll write what they're passionate about. You can email them. They may not email you back, but you can send out 10 emails and see if anybody says, yeah, say, I just want one afternoon watching what you do. And they might say, yeah, no problem at all. So those would be some ways. So.
And there's also other ways outside of the hospital, too, that you can do. Like, for example, when I was in undergrad, I volunteered it was kind of a halfway house for foster children. So I went there one night a week, and I got to hang out with the kids and help make dinner and put them to bed, and doing things like that too. So there are other opportunities outside the hospital that you can show your passion. You can start to show leadership if you do it long, and you can show that longitudinally, like, hey, I didn't do that just for a month. I did it for 2 years.
When you were volunteering at UCSD, did you feel like as an undergrad you were able to have experiences that really impacted you, or was it just like mere filing and faxing, and because I've heard that you can't really get involved because you're not a medical graduate student?
Yeah, I forgot to be repeating people's questions, so I don't know if I should still be doing that. Yeah? Okay, so the question was, when I was doing volunteer work as an undergraduate, was I having real authentic experiences, or was I doing mostly faxing and filing? No, it wasn't a very authentic experience. It was great. I learned a lot. I was able to observe operations, and I worked on helping autoclave, i.e. Cleaning and preparing kits for procedures. So it wasn't necessarily that authentic, but I didn't pursue something that way. I went and volunteered where they had room for me. And another option for me, which would have been wiser, would have been to go back and say, what can I do that's more than this? Or I want to do more than this. I know the system, what's the next level? Or is there somebody you know that could help me with that? So I agree, a lot of times in hospitals, the experiences available to you aren't quite as authentic because there's a lot of laws and regulations around what you're legally able to do in terms of patient care if you don't have a degree or if you're not in training. That's what really causes the big limitations, which is why we threw out some ideas out there about the ideas of maybe research or advocacy, camps, things like that, other places where you might be able to do something that's interactive but not necessarily totally medical. Yeah.
And you may say that that volunteering experience may be a stepping stone, that you meet someone to kind of get that next spot too. So I wouldn't go in there and be like, oh yeah, I'm not going to do that, I'm not going to do that, I'm not going to do that, because all of a sudden you're going to be in your 4th year of undergrad and be like, okay, I said no to everything. But you could take it as that too, as like, okay, this may not be the experience that I want, but I'll get something out of it, and I may meet someone who will get me to that other volunteering experience I have.
Another caveat would be, I know a lot of, or at least some of the people I've met at this conference have finished their training and are in that transition time. But if you're actually still in undergraduate training or in some other school of training, if there's a way to get involved in a club or a group in which you're able to organize events, you could create an event. You could contact somebody who works at a hospital and say, we would like to donate something to whatever, and have an interaction with children be a requisite for that experience, and then you get that interaction. So that's one idea, creating individual events that you help coordinate so you can interact with kids on a level that gives you more experience and more meaningful interactions.
I think we're hitting our 11:45 time, but we're going to be here, so if you guys have any other specific questions, come on up and let us know.
Emails?
Oh yes, and
so normally we would have written our emails on the board, but it wasn't there. So if I can tell you what our emails are, please feel free to contact us if you have questions. My name is Michele Long, and the email is Michele with one L, MICHELE .long, LONG, at ucsf.edu.
And mine, unfortunately, is much longer. But I am Kate Sutter, and my email is Kathryn, so it's KATHRYN, .Sutter, SUTTER, at ucdmc.ucdavis.edu. All right. Enjoy the rest of your 2-day conference. Good luck.